there's just so much.
You're listening to a Mamma Mia podcast.
Australian women, welcome to your full body health check. I'm Claire Murphy.
And I'm Dr. Mariam.
Today, we are talking all things about making babies from a list of questions that you all have been sending in about this topic. And holy heck, did you have some questions. We have looked into things that I have never even heard of before, including the best time to do your IVF rounds. We have touched on this, but whether decidual casts actually might impact your fertility. And we even get into some pretty sad moments too, like how to cope with those times when your little human doesn't quite make it into the world. And normally in these question and answer episodes, I introduce you to the body part that we've been talking about. So we've introduced you to your pelvis and your mind and your brain. But today I was like, what do I introduce you to when it comes to fertility and pregnancy? I was like, oh, do your uterus. And then I was like, no, we're going to welcome you to motherhood today. So I just watched a video of a Thai woman whose dad had stepped in to help her with her confinement period. And this is something they refer to as doing the month, because mum and baby in some cultures stay home for 30 days after birth. Mum's told to rest and recover while she is brought food, non-spicy food in recovery.
Love this.
She's helped with care for the baby. It's seen as a way to restore mum's health before she has to get into the whole thing of motherhood, because it's a lot.
This is your village.
This is your village.
Yeah.
It is something that we typically see in Asian cultures, like in China, South Korea and Japan. Not so much here in Australia. It does happen. But unless, say, you're Aboriginal or Torres Strait Islander and you give birth on country surrounded by your family and your aunties, many of us go home kind of just on our own. And maybe your partner, but your partner gets less paternity leave or maternity leave, depending on what kind of relationship you're in. And so oftentimes you're kind of left to your own devices. And look, I don't know what it's like if you're in a lesbian relationship or a queer relationship, but when it's a hetero relationship and you've got a man coming home with you who often feels he doesn't know what the hell he's doing, they might help with some things, like the obvious things, nappy changes, bottle feeding if that's the way you choose to go, if you go with formula. But if you are solely breastfeeding and you have to get up 4 times a night, dad often feels like, what the hell am I even doing here? It can be a really daunting experience.
Yeah.
And Mariam, a lot of the focus is on physical recovery from giving birth, but that we're told takes around 6 to 8 weeks. But realistically, it can take years for your body to really come back to feeling like your own again. And that's a whole other psychological experience as well. You might experience some things like incontinence, and you might have to work on your pelvic floor. You may require time to recover from an episiotomy, which, the resulting stitching can sometimes take a little while to recover. Afterwards, your hair that was super luscious and beautiful and flowing during pregnancy, see you later. It falls out, you go and have a shower and you've got handfuls of it. Don't panic, totally normal. Some people, though, fill up with fluid, and then at the end, and you've sent me a picture of your feet while you were pregnant.
They were nasty feet.
Whoa. Yeah. But what you don't realise is that after you have your baby, that fluid has to go somewhere.
Yep.
And it all comes gushing out. You will do wheeze longer than you have ever done in your entire life. You do deflate like a bit of a balloon. C-section scars also take a while to heal, but that also really depends on you as an individual. Some people I spoke to said they were shocked at how quickly they recovered from their cesarean, some 10 days. Some said a few days when it was their second or third cesarean because their body kind of knew what to do. For people who said they had a planned C-section, so not an emergency, said it was easier to recover because they hadn't gone through that whole labouring first and they weren't exhausted by the time the cesarean happened. All of the people I spoke to who had a C-section said they were very grateful not to deal with pelvic floor issues afterwards. The hormone avalanche that you experience during pregnancy and birth actually physically changes you.
And postpartum.
It changes your brain, especially the drop in estrogen. Parts of your brain involved in processing memories and emotions and parts that deal with decision making, they can decrease and that can last for years.
Yeah.
So your physical brain is changing, and that change in social cognition also makes you better able to read your baby's needs, which is amazing. It's why so many doctors will tell you trust your instincts when it comes to your baby, because your brain has actually physically changed to be keyed into that.
It's amazing.
It is incredible. You increase empathy. This is one I did not expect.
This is why men need to give birth.
I've worked as a journalist for decades before I had my kid, and I have seen and read and investigated many awful stories. But after having a baby, I could not read any stories that involved children.
Yeah.
It was really strange.
Completely agree.
It is a major emotional shift. Sometimes we hear of it referred to as the baby blues, but there's a period of feeling sad and teary or maybe irritable after you give birth. And if those feelings linger, it could turn into postnatal depression. So you need to be really careful about that. You might end up dealing with hemorrhoids or constipation. You might have none of those things. You might breastfeed like you've been doing it forever. You might find it really hard and a struggle. And you'll deal with judgment from people who tell you that formula feeding is awful for your child. But trust me, just do whatever is good for you and your baby. You could face things like mastitis, which is a blocked milk duct. And geez, that is
nasty. It's so painful.
Your boob turns into like a rock, a hot rock. It is not comfortable. Your baby might come out healthy as a horse. It might come out with some issues. Sometimes that won't even be evident at the start. That might be something that you discover later on down the track once you get to know them a little bit better.
Yeah.
And there's obviously those mums who never got to take their baby home, and that I want to say to people, some friends of mine have also gone through this, and I want you to know whether you took your baby home or not, whether you ever saw your baby, whether you held your baby or not, you are a mum.
Yes, that's correct.
From the moment you conceived that baby and you thought of yourself as its mother, you are a mum.
100%.
Your birth experience might also be guided by your cultural background. Maybe because you're part of the LGBTQIA plus community, you might also have a different experience if you're doing it solo, which I know so many women who've done that in the last decade or so. Some women don't want to wait around to find the man who's going to do this for them. Sometimes they don't want a man at all. Sometimes
that's a fair decision. Go you.
It is a total fair decision. Maybe your tiny human came to you via surrogate or through fostering or adoption. There are also studies to suggest that those major changes that we see in women who give birth also happen to women who foster or adopt babies.
Yeah.
Actual brain changes. Becoming a parent, regardless of how that came to be, it's an immense production.
And it's a privilege.
It is a privilege. But realistically, Mariam, we've talked about this before, there is nothing you can tell a new mum to be what to expect, because what to expect when you're expecting is to expect it all and none of it at the exact same time.
Real talk, you are so right. There's honestly nothing you can say to fully prepare someone to become a mother. And you know, you'll feel things you didn't even know had names. You'll laugh, you'll cry, you'll leak. I'm still leaking. So yes, you'll ache, you'll love, you'll rage, and sometimes all before breakfast. You will cry over spilt milk.
Yep.
Literally, you'll Google things at 3 a.m. that you never thought you would Google.
Yep.
And no checklist, no birth plan can capture the chaos or the beauty of it. Some days brushing your teeth will feel like a win, but here's the gold. You're not meant to do it alone. The secret isn't having it all figured out. It is about having a village. And I know for some people that's really hard, but mothers groups, whatever it means, your neighbor, have some support around you. It's so important. We're not meant to do this alone. And so no, I can't tell you exactly what to expect, but I can tell you this. Lean on your people, ask for help, say yes when it's offered. Don't be polite, because the wild, wonderful mess of motherhood was never meant to be a solo act.
100%. And if anyone tells you sleep when the baby sleeps, you have permission to get real mad. Do whatever it takes to get you through that. I just want to finally say though, Mariam, I just want to note something I didn't expect when you become a mum is how boring it is. And I say this with the utmost respect and the fact that it is a privilege to be a parent, but it is repetitive.
Yep.
And it is the same thing. Get up, eat, change a bum, try and have a shower. Like, it is so boring. Also, one last piece of advice is do not ever bathe your child in anything that has a scent. And I mean this when they're little babies, because the smell of new baby.
Oh, goodness.
It is like a drug you cannot
Claire,
Oh my God.
can I tell you how many times when I get bubs come in for their 6 weeks checks, I have to like say in my head,
Don't sniff
Mariam,
the baby.
don't sniff the baby. Do not kiss the baby's head. Like, how awkward would it be if you see your doctor just like getting a
Oh my
sniff?
God, can you imagine? I took my baby to the doctor and she sniffed it. Is that normal?
The amount of work I have to do to not sniff that gorgeous newborn's head is so much work, just so you know.
I say hats off to you for not sniffing more babies. Okay?
I'm sure I have once or twice, and if I have, I'm sorry in advance.
So I guess, Mariam, we've had a bit of a laugh about, all the bits and pieces of
Yeah.
motherhood that come together, but like nothing seems to matter anymore because when you have that baby, like you become obsessed with it and it's the
Yeah.
most wonderful, glorious, weirdest thing in your whole life.
I could be having the worst day possible and just one sniff or one cuddle, and I cannot explain to you what that does. It just melts everything away.
And you will be shocked at how long you can just stare at your baby for. Like hours of your life have gone and you're like,
scary.
I've just been staring at my baby. All right. We will come back in just a tick because we have some incredible questions from you to answer with some help from our expert friends.
It's time for the checkup.
All right. Let's kick it off with you today, Mariam.
Yes, let's do it.
How do you deal with the monthly disappointment of not being pregnant again? My mental health is in a nosedive.
Okay, this is a hard one, and I'm really sorry you're feeling this way month after month, only to be let down again. It's a kind of grief that's really hard to explain unless you've been in that situation. And I just want to say you are absolutely not alone in that spiral of hope, that heartbreak, and that exhaustion. Trying to conceive isn't just about biology. It's that emotional marathon. It's that monthly negative test that can feel like the finish line just keeps getting moved further along. I've been there month after month and hoping, counting, symptom spotting, waiting, peeing on that stick, and then seeing that negative test again. It is just so heartbreaking. It's like a punch to the gut. So how do you cope with that disappointment when it happens every month? So I always want to say, number one, acknowledge your grief. It's real. It's okay to be devastated. You're not overreacting. Every cycle represents a dream, a timeline, and hope. And when it doesn't happen, you're lost. It's a loss, and that loss is valid. So allow yourself to grieve. Talk about it. Do not carry this alone. Find your person, your village, your support team, or a professional who can hold that space for you. And I felt personally when I started speaking about this out loud, I just felt like a massive weight lift off my shoulders. Fertility journeys can be deeply isolating, and that connection can bring back that oxygen and really, really help. Give yourself permission to pause. You don't always have to keep pushing. If you need a cycle, you want to take some time off just to breathe and reset, that's completely okay. And it's not giving up, that's just kind of protecting you. And then lastly, remember that your worth is not tied up to fertility. You're not broken, you're not failing. You are just navigating something completely complex and doing it with more courage than you're probably giving yourself credit to. If this journey is taking a toll on your mental health, I did fall into depression during my infertility journey. It's a signal you really need to prioritize support. See your GP, a fertility counselor, a psychologist, whoever that may be, that can walk this road with you and help you find that light again, even if it's just one step at a time. Yeah.
Be kind to yourself.
Be kind.
Okay, moving on. We asked some questions of Dr. Justin Tucker, who's an obstetrician and fertility specialist. So we started off with this one. My friend said she got pregnant after doing a few unsuccessful rounds of IVF when they switched to having the implantation done during her normal ovulation period. Is that true? Does it increase your chances?
I think what she's saying is that when we've got an embryo that we've made from IVF, we've got the option of either giving some medicine to build up the lining or just naturally tracking the cycle and putting it in the embryo in 5 days after ovulation. Now, of course, the biggest determinant about whether it's going to work or not is the embryo. So it might have just been that this lady's embryo was, she got the right one when they decided to transfer in a natural cycle rather than a medicated cycle. But in general, we tend to try and use natural cycle. But there's plenty of ladies out there, such as those with PCOS, that don't get a natural cycle very reliably. And therefore, we're going to have to build up the lining with medicine, which is also totally fine.
Can I be a surrogate for my friend who's had to have a hysterectomy? How do we start that process?
One word answer, yes, you can. And what a brilliant thing to be thinking about doing. It is a bit of a process, often starting with counselling and making sure that this person's, from a medical point of view, a suitable surrogate and is making an informed decision in terms of risks to both her and potentially, the pregnancy and the baby. How to start is get in front of a fertility specialist that's experienced in this, and step by step, you get there.
I've always had a short period, but every single period for the last few years, I pass a full decidual cast, which is something we have just learned exists, to be honest. I'm currently undergoing fertility treatment after several years of trying to conceive, and all my blood work and tests have come back with no issues. Can a decidual cast cause issues with fertility?
If you've got a question that you feel like is not being answered, I think you need to give your fertility specialist another chance to answer it. Maybe it's sort of got glossed over, maybe not so important from an outcome point of view, but if it's important to you, then again, bring it back up. In general, that's not something that we sort of link with fertility treatment success, natural conception success, but any irregular bleeding should be investigated.
We also caught up with Associate Professor Kirsten Palmer from Monash Health Obstetrics and Gynecology to ask this next lot of questions. This first one, and I think a lot of people might have experienced some weird changes while they were pregnant. The first question we asked was, my teeth moved and my feet got bigger when I was pregnant. Is that normal? Will it happen again if I have another baby?
So it is absolutely normal to experience those two very strange features of pregnancy. So the teeth becoming more mobile and moving during pregnancy is really normal, and it's because of all those hormonal changes again. People often are aware that their hips are moving during pregnancy and they can get this pelvic girdle pain. Well, it's the same hormones that are causing our hips to become a little bit more lax and a little bit more loose that are having the same effect on the ligaments that support our teeth as well. So that's what's driving that. And the swelling in the feet, just that increased challenges of blood flowing out of our feet back past baby, where we get some of that fluid leaking out into our feet. So it is a very common thing to happen in pregnancy. Won't happen necessarily in everyone, but around 75% of women will get swollen feet in pregnancy.
Is there actually a way to not get stretch marks?
Unfortunately, no. There probably is a genetic contributor to some extent as to why we get stretch marks, and others are just that, our body is changing and growing over quite a rapid period, and it's that rapid growth that is linked to that. So the best things that we know that can minimise the likelihood of stretch marks is to try and stay well hydrated, keeping the skin well moisturised, and they're really the best approaches that we've got at this stage.
Final question. Can you have facial anti-wrinkle injections when you're pregnant or trying to conceive?
We don't have that much safety data at this stage around the use of injections during pregnancy. We use it for some medical conditions, and so we're still trying to kind of get that data around, can we still use that for those medical conditions in pregnancy? At the moment, the recommendation is to avoid it because we just don't still have enough safety data.
Back to you, Dr. Mariam. I stopped breastfeeding 3 months ago, but my boobs are still leaking a little. When will this stop?
Everyone's journey is a little bit different when it comes to breastfeeding, and it is actually normal for your breasts to continue to leak a little bit after you've stopped, even months after you've stopped breastfeeding. It can be kind of annoying, but here's what's going on, why it's still happening. So prolactin takes time to settle, and that's the hormone responsible for milk production. For some people, it can take weeks or even months to kind of return to its baseline, especially if you were breastfeeding for a long time or weaned gradually. Then stimulation equals supply. So even small amounts of nipple stimulation, like just putting a bra on or sex or clothing can trigger a letdown reflex. Sometimes even the baby crying can do that. So your body's incredibly sensitive during this time. And some milk ducts just take a little bit longer to shut down. It's not uncommon for milk or clear fluid to leak occasionally for up to 6 to 12 months after you stop breastfeeding. See your GP if, there are any other associated symptoms or you've got any cause for concern. They'll either offer reassurance or exclude anything else that it could possibly be.
Next question. Since having a baby, my BO is off the charts. Is this normal?
Okay, look, postpartum birth, your hormone levels, especially your estrogen and progesterone and the prolactin, they shift dramatically. The shift can kick your sweat glands into overdrive, especially in places like your underarms and your chest. And if you're breastfeeding, your body also produces more sweat, and that type of sweat is associated with a stronger odor.
Sorry, baby. If you're getting breastfed with hardcore BO.
But interestingly, the new scent isn't just a weird side effect. Your natural postpartum smell actually helps the baby bond with you. So it's a part of how they recognize you. It's like, that BO is my mama. And then the third reason, sleep deprivation, stress, and not prioritizing a shower can also, lead to a bit more.
When you had, you have twins, so I can't even imagine when you ever showered.
Did I?
But I'm not, how many years did you not take a shower for?
I lived off wet wipes. It was
like you do. You do, honestly. You hit a moment where you're like, especially when you're home alone.
Yeah.
And you're like, I desperately need a shower, but I just can't.
Yeah.
You can't leave a tiny, tiny human by themselves.
Oh, goodness. There are points where I'd put them on the floor and I'd be on the toilet. Sometimes I couldn't go to the toilet. You'd have to take the babies in with you.
Yeah.
I'd be so afraid, what if something happens or they roll off? So they'd just be sitting there watching me take a dump. Yeah. It's hey guys.
This is our life now. That's just how it's got to be. Okay.
Yeah.
Let's move on. Dr. Nargis Nouri, an obstetrician and advanced gynecological surgeon, and Betty Holland, who's a clinical midwifery specialist from Women's and Newborn Health at Westmead Hospital, have helped us out with the next couple of questions. I have moderate prolapse after the birth of my second child. It's been devastating as I was a marathon runner before. Why isn't prolapse risk discussed with pregnant women? What can we do to educate women so they can make risk-informed birth choices?
I have to say a lot of the postpartum stuff does get neglected when it comes to caring for birth and pregnancy. It's a bit unfortunate because we do focus a lot of our antenatal education towards what's happening in your pregnancy and around your birth. And a lot of the things afterwards, such as breastfeeding and contraception and all the potential down the track issues and prolapse, we just don't have the time or the resources to kind of go into that. But yes, prolapse is a risk of childbirth. There are some things that increase your risk further, such as if it's your first baby, if your baby is a little bit bigger than the average baby, if you've had to have some help during that delivery vaginally, like using a suction cup or a forceps, you have an increased risk of prolapse. If you're someone that engages in a lot of heavy lifting, most of the time when you have a prolapse in the acute setting, it does get better with time. And we do kind of try and reassure our women that it will get better. Your body's just been through this enormous physiological and physical change for the last 10 months, and it's important to give it time to then recover. Unfortunately, there are some that have persisting prolapse issues. So prolapse is basically, I kind of describe it to my patients as like a hernia in the vagina. So you have certain organs that can outpouch through the vagina, and it can either be your bowel, your bladder, or the actual cervix or uterus. And you normally feel it as like a bulging or a dragging or an uncomfortable sensation in the vagina. If it doesn't get better with time, the best thing to do is to see a pelvic floor physio. They engage in pelvic floor exercises. They teach you how to do it properly. And if it doesn't get better over time, then we have other sort of medical options that we can always discuss about either symptom control or surgery if it comes to that.
I've had 3 cesareans for 3 very big babies. My stomach muscles have never gone back together again, and the gap is so big I can feel my intestines moving behind the skin. Will it ever go back together by itself, or do I need surgery?
So abdominal wall separation is that's commonly known as. It's not just from a cesarean section, and it's secondary to a few things, hormonal changes, physical changes, but just your stomach growing over time and weakening those muscles. And it's basically those long muscles that give you that six-pack look if you're ever lucky enough to get one. And they just weaken over time, and then they separate during the pregnancy. It does, for many women, just over time get better on its own. You can feel it when you've given birth. If you lie down and you kind of lift your head up a little bit, you can sometimes feel a little separation or a gap between the muscles. That's how you know you've got one. And you might also feel like a lack of support in your core or in your back. It's very important, if you feel that, immediately to touch base again with a physio. A lot of hospitals, whether it's public or private, will have access to that service, whether they see you straight away or make an appointment with you in the postpartum period. But again, it's about individualized exercise programs to help, and avoiding things that would make it worse, such as, crunches and sit-ups and trying to get back into shape really quickly. So you do have to be a little bit gentle with your body. It does get better with time, but sometimes you do need the guidance of a physiotherapist.
I'm 33 and 11 months postpartum with my second child. I've always struggled with varicose veins. Since this last pregnancy, I now have them in my pelvic area. Each time I get my period, I've been having intense pressure in my pelvic floor area, which feels similar to the pressure whilst in late pregnancy. The pressure in my legs from my veins is also quite unbearable for that first day, and I've also noticed a change in my veins. The spider veins become really red, and it's like they spread all over my legs. I initially thought I may have a bit of prolapse from the pelvic pressure. However, now I'm thinking it's all related to my veins. Could that be it?
It could be that. It could also be prolapse. I think it's important, if it's a persisting symptom, to get someone to have a look at it. But varicose veins or in the vulva region is actually another thing that can be quite common in some women during pregnancy, and it's just because of the excess blood flow into that area and the hormonal changes that come with it. So you kind of get very pronounced veins, not just in your legs, but even all the way up to the vulva. It can be quite painful for some women, and they do experience that intense pressure-like symptom as well. But there are some things that can be done. So one time, yes, heals things, and it will get better over time once your body's naturally physiological state goes back to normal. But in the meantime, you can use things like ice packs to help with the pain, painkillers, whether it's prescription or non-prescription. There's some compression garments, both for your legs and even ones that kind of cover the pelvic area, that can be fitted if it gets really bad. And then I guess if it doesn't go away over a couple of months or it's getting worse, then you probably need to touch base with with probably your gynecologist to see what other more invasive management options there are for you.
I keep seeing this everywhere online. Is it true that DNA from your child and its dad stay inside you forever after you've given birth?
So this is something that's called fetal microcharism, and it's basically the presence of fetal cells in the maternal circulating blood volume. And it is true that these fetal cells can stay in the circulating blood volume for decades after the baby has been born. It's an interesting one. It's quite beautiful to think about as well.
Okay, so far we have covered lots of questions about getting pregnant, being pregnant, and giving birth. But we also wanted to include some really important parts of this conversation and things that you have been asking us about, but they could feel a little bit confrontational, especially if maybe you're at the very start of your motherhood journey. I know when I was pregnant, I followed lots of groups and things, and sometimes things would be a bit sad or scary, and so I tended to avoid them. So I completely understand if that's what you are doing right now. Protect yourself wherever you need to. But we think it's really important to talk about things like postnatal depression, miscarriage, and stillbirth. So just a heads up that is what we are going to be talking about now. If you want to do a little mute for a minute or two, just to give yourself that breathing room. So first up, we spoke to Dr. Erin Sito from the Gidget Foundation Australia to ask this first question from one of our listeners. I've been having intrusive thoughts since having my first baby 5 months ago, and I'm too scared to tell anyone. They go on to say, I'm sure I wouldn't actually do anything, but the more I try not to think about them, the more they stick in my head. It's really upsetting me. I feel like it's ruining the experience of being a new mum. What can I do to make them go away?
I would encourage you to speak to other people that you trust first and foremost. I think that things like intrusive thoughts are often exist in the dark and the silent parts of our lives, and they can create shame and fear, which can then fester into other things and makes the situation feel much more overwhelming than it might be. So being able to share that with others is really important. I think it's important to normalize intrusive thoughts. So more than 70% of new mums experience intrusive thoughts. They can take the form of thoughts about something bad happening, and often they are in relation to parenting or your baby. And they're intrusive because they cause significant distress. And this distress is important because often that's an indicator to us of how much you care about your new role as a parent and also as your baby. But it is really important to seek the correct support and a proper assessment of those thoughts. Sometimes the intrusive thoughts can resolve and reduce on their own. However, ensuring that we have that assessment is really important in order to manage risk, because sometimes they can be an indicator of something more serious, such as postnatal psychosis or OCD or other other things that might need just a bit more stepped up care. And so psychologists and other mental health clinicians are trained to support you, both in identifying the types of thoughts that you're having, and then also to create a treatment plan and support you to manage those thoughts so that you're not on your own.
Our next question is not from someone who's experiencing it themselves, but is watching someone go through it. They've written, I think a friend of mine is really struggling with being a new mum, and I don't think it's just readjusting to it all. I think there's more to it than that. What do I need to look out for in case she might be suffering from PND?
So I think it's really important that you are a good friend and know that this is probably a bit more of a long game for you. Having someone that can track changes in behaviour over time is really crucial for professionals like myself to be able to provide the right support. We know that 1 in 5 mums and 1 in 10 dads experience PND. Symptoms of depression might be more tearful than usual, feeling a sense of numbness, a loss of pleasure or enjoyment. Withdrawing from others is not another sign, whereas anxiety might be more intrusive thoughts that are distressing, difficulty in relaxing or switching off, and really finding it difficult to sleep even when the baby's sleeping. So being able to track those, and usually what we look at is a 2-week window, and we look at are more days than not a struggle for the person. So having that really trusted relationship, being with the person, showing up, being consistent as a friend is really important, because then that allows you to start asking those questions like, how long have you been feeling this way? How often in the week do you feel this way? Or how often in the day do you feel this way? And don't wait for that person to kind of flag these difficulties with you. Often parents are really overwhelmed. So it's really important that you reach out and ask these questions and really listen for those indicators of enjoyment and worry in the answers that you're getting and how they speak about the baby. And then encourage them to speak to a GP. If they don't have a good support team around them, then it's okay to choose a new support team and get the care that you really need. Knowing that recovery does happen with PND with the right support is also crucial to share with.
And who should people be reaching out to in the first instance if they are experiencing things like this?
Sure. I mean, I think the more that we can share it, the more people we have looking out for the mum. So that family system and network is important. But then from a health professional point of view, your GP is always your primary carer. They're kind of the gatekeeper to other services. So they're really important. But absolutely look on our website. We have fact sheets. We have information. We have our peer support platform through our private Facebook groups. We have our Gidget Village group program as well. So there's lots of different types of supports. And sometimes it's about educating yourself and then working out what's the right thing for you. But if in doubt, just reach out.
We also had a few questions come in about pregnancy loss that we wanted to speak to someone who is really knowledgeable in this space on. So we caught up with Samantha Payne, who's the co-founder and CEO of the Pink Elephant Support Network, which is a group you've been working with.
Yeah,
Mariam.
I love them. They really helped me through my losses.
Yeah, they're great. So the first question for Samantha was, I have to make the very tough decision to end my pregnancy due to a health issue that will mean my baby won't survive. I still have to give birth to him. What do I do when he's here? What am I allowed to do and what happens after?
Firstly, I'm so very sorry that you're here and you're in this position and having to make something that's framed as a choice, but really often our community tell us it's not actually a choice. And you're making a choice that's filled with nothing but love and compassion for your baby. And I'm so sorry that this is happening to you. What we hear from our community in terms of termination for medical reasons is really taking time to acknowledge what's going on for you and, again, accessing support. Pink Elephants is there for you. There's other organisations as well like Red Nose and Birds of Hope that do incredible work for later term losses. We also want to make sure that when a woman experiences what's referred to as a termination for medical reasons, she experiences support that's connected to that type of loss as well, because it can be different, because there is a decision to make. There is a process that she's going to go through. She's going to have to go to hospital, like she says, and give birth to a baby that's not alive and then make some decisions around them. What we've heard over time is the comfort in taking time to make that decision yourself and to have that support around you, particularly when you're going into that scenario. Reach out to other women who've been through similar experience, access peer support to those that can share with you what helped them so that you can make really informed choices and know that whatever choice you make is right for you in your decision. But yeah, definitely just try and access as much support in the lead up to that experience so that you have options that you feel like you've had a chance to kind of process and go through. Definitely don't do this alone.
My next question to you is, I was totally unprepared for having a miscarriage, both physically and mentally. When it was happening, I had no idea of what to expect or how much blood was, in quotes, normal. Afterwards, I was extremely upset, but didn't feel like I could talk about it or just had to get on with it alone. Why aren't women better supported when they lose a baby?
Oh, this personally is something that's happened to me as well. And this was what drove me to create Pink Elephants, that very experience, a missed miscarriage where you were confirmed that the baby's passed away and then you're sent home for what's referred to as natural. And it's anything other than natural. The amount of blood loss can be very confronting. And when you're not given any information, again, on what to expect or how to deal with that, you're added trauma there. That is something that you need to make decisions in that fight or flight experience of, well, what do I do? What's normal? What's not? Do I go to emergency department? I want to advocate here that you can call Health Direct and you can have a phone call with a nurse that can help you to decide if you're in that situation right now. So seek medical advice. But in terms of why society doesn't talk about this, it's confronting. It's the death of a baby. It's blood loss, which is a women's issue that we often hide our periods still. There's still social stigma around that. So therefore, society finds it easier to look away. And what we do is we don't talk about it. And then when it does happen to women in this way, we feel unworthy of support. We feel unseen. We feel invalidated in our experiences. And then we isolate ourselves further, which is basically disenfranchised grief. Because you can't see our babies, it's almost like they don't exist and it's easier to look away. And what we at Pink Elephants are asking you to do is to lean into difficult conversations, to not look away from your friends that go through this, to be there, to be a support person for them. And actually, it's not that hard. Your main role would be listening to that person and what they need and letting them often offload what's happened to them, like that experience that is incredibly traumatic. And I personally found that so frightening at the time that I went through that. I couldn't use my ensuite bathroom for a couple of years after that experience because each time I went into it, I was deeply triggered. And so I know firsthand, but sadly, I see this experience every day in our online communities. And so I'd again really, really, really inspire and urge you to join an online community, to speak to other women who've been through this, because there's nothing like, it's like a salve on like a balm salve on like a cut or an open wound when somebody sees you, when somebody gets this, and it's like a weight is lifted off your shoulders and you no longer need to hide or wear a mask or pretend that you're okay when you're not okay. That's what Pink Elephants is. That's what we're here to do. So yeah, please reach out and don't go through this alone.
What's the best way to reach you guys?
pinkelephants.org.au. Really simple. You can find us at Pink Elephants Support on socials as well.
Once again, so many amazing questions.
So many.
We've all learnt quite a bit more about our bodies as we went through the whole fertility, pregnancy, birthing journey. And remember, you can send through questions too if you want to. We have an email, which is well@mamamia.com.au. If you want to remain anonymous, we've got a link in our show notes to the waiting room, and that'll explain to you how you can go through that step by step. And you can also, if you want to appear on the show, drop us a voice note. There's a link in there too. You could hear yourself send in your questions, which would be so fun. Coming up in the next few weeks, we're going to be getting our snooze on. So if you have ever had or still do have issues with sleep, we're getting right into our brains and bodies to find out how we can do it better, how to handle it when we're not quite getting it right, and what we need to change for ourselves in order to get some good rest. Remember, the information you've heard here today is general. It may not suit your specific needs. Make sure you speak to your own healthcare professionals. Hit up your GP to get the information that's right for you and you only. And, of course, we will catch you for your next appointment.
Looking forward to it. Bye-bye.
Well is produced by me, Claire Murphy, senior producer Sasha Tanek, with audio production by Scott Stronach and video production by Julian Rosario.
Mamma Mia acknowledges the traditional owners of the land we have recorded this podcast on, the Gadigal people of the Eora Nation. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander cultures.
Hi, I'm obstetrician Dr. Patrick Maloney.
And I'm Bridget Maloney. We're the hosts of The Kick, the pregnancy podcast that breaks down everything you need to know about making and growing a tiny human.
We cover it all with expert information and evidence-based discussion. based on our experience of running a women's clinic and being parents to 4 boys.
From morning sickness to birth plans, strange cravings to baby movements, listen to The Kick wherever you get your podcasts.